This is Doc Talk, brought to you by Plateau Medical Center. And now, Dr. Paul Conley.
Good evening, I'm Dr. Paul Conley, and thank you for tuning in to another episode of Doc Talk. Today we are on site here at with Dr. Anita Stewart. We're here at the health department, and again you can see we are outside and we're social distancing. Dr. Stewart is our health officer, and she's going to be back on the program today, and she's going to try to help guide us with some of the nuances with the metrics that have changed somewhat since our last show. And she's also going to help talk about some of the things that we're going to talk about with influenza and vaccines. So Dr. Stewart, thanks for being on the program again.
Yeah, thanks for having me, Paul.
So, Dr. Stewart, things have changed since, our last program. Now we're in the fall and we're back to school. And so I think, when we talk about being back to school, there's this color-coded map, okay? And I know, people who watch television have seen the Harvard model, and we have the different colors from the green to yellow to orange to red, but now there's an additional color. The color is gold. And then we've seen about, the metrics and how we calculate those metrics. So if you don't care, maybe you can sort of guide us through a little bit about these colors, the metrics, and exactly what that means and how that translates to our community spread.
Yeah. So I think it's really important not to feel overwhelmed by all of the numbers and all the different colors and all the different changes that are happening. And to remember that the goal is that we have objective ways to look at what's really happening in our communities, because we know that what happens in Fayette County, for instance, might not really reflect what's happening in Monongalia County and vice versa. So it gives us an idea of really what's happening in our community, so we can put guidance out and recommendations and adjust our behaviors depending on how much spread is really there. So the first place I really like to look when I'm talking to my family and friends or patients when we're looking at the numbers is to go to the globalpandemics.org website. That is the Harvard website. That is an incidence-based model, and what incidence is how many cases are happening per day. So that's the actual case. And the way they look at that is cases per 100,000. So that adjusts based on population of our community. So in Fayette County, we have just over 42,000 people. So that would adjust according to our population. And then they use levels of how much incidence you see per 100,000 to determine really what's going on with community spread. So of course, the higher level of incidence per 100,000, the more community spread. And then they also have a collar system that relates to those levels. So red is over 25 per 100,000. So in Fayette County, if you do the math quickly, it shakes out to about 10 cases per 100 or per our population for a 7-day rolling average per day. So if you look at those models, it can help tell you really what's going on in your community. Now, if you go for West Virginia specific numbers that are from our dashboard, you can go to the DHHR COVID website and look at that county alert map. And that's the map that we're using in West Virginia to tell us about, when we go to school, what nursing home visitation is recommended, athletics, those types of things. And the recent change was to add the gold color, and that was to make the orange category a little bit smaller. So gold would be between 11 and 15, or 14.9, and then orange would be 15 to 24, 25 and above is red. And so the goal was to have a smaller window or smaller level there. The important thing when you're looking at that map is to remember that we now are also looking at percent positivity, which is a little different than incidence. Percent positivity has to do with how much we're testing. So when we look at that map, remember that's telling us how well we are testing. We should be our percent positivity should always be less than 3%. If it's above 3%, it means we need to test more. So yes, I think it is very important that we're testing. Everyone should be getting tested, particularly those that are close contacts. Anyone that has any symptoms, remember even vague symptoms are important reasons to be tested. So it is a very important measure, but the most important measure in my mind is incidence. So on that web page, you can also click on the incidence and it will show you the trend line of what our incidence is. And so for this week in Fayette County, we've been running anywhere from 14 to 16 per 100,000 for our 7-day rolling average. So we still have a moderate to high level of community spread here at this point in time.
So when you talk, so I guess I have a couple questions. So when we talk about that 7-day rolling average, from what day to what day is that? And can you explain that's an average? So you can maybe have 21 day and you may have 10 another day. So you would be 30 divided by 2. Is that how that works? Or how do you come up with that rolling average? And from where to where does that start and finish?
Yes. So when we're looking at the rolling averages, that's a day-to-day thing. So they basically, if it's Tuesday to Tuesday, it would be from there. And then on Wednesday, it goes from there. When we're looking at the school map in particular, so this is the map that the Board of Education uses to determine the recommendations for school and the recommendations for the WVSSAC for athletics. That map is from the numbers at midnight on Thursday night and is released on Saturday at 5 p.m. So that's a Thursday to Thursday number. But everything else is a 7-day rolling average when we're talking about incidents.
So when you talk about percent positivity and we talk about testing and you talk about, we want to try to keep that number as low as possible for over 5%, we need to test more. So what is more? What number would you like to see, Dr. Stewart, that we're testing like in any given day? Can you give us an idea of where we should be?
Yeah, so for Fayette County, we look at population and I like to test around 3 to 5% of the population in a week if we can, especially when we're in high levels. Remember, one thing I haven't said yet, the most important thing about testing is that we can potentially identify patients or people in our community that are either asymptomatic and positive, which we know happens about 40% of the time, and they can still spread virus, or we can identify people that are what we call pre-symptomatic, that haven't yet developed symptoms. And what we know is that people that are pre-symptomatic, their viral shedding is very high during those 2 days before they develop symptoms. So if we can identify those quickly by doing high levels of testing in communities, you can quickly case investigate them and contact trace them to stop the virus spread. Remember, it's a virus, it needs a host. And so if you can stop the transmission of the virus, you end the spread and essentially end the life of that particular, the virus. So
when you have a patient like that you're able to catch during contact tracing, what do we do with that patient? So how do we go about that individual is tested at one of your testing centers and they're positive? So maybe you can explain a little bit how do you effectively contact trace and how do you prevent that virus from spreading, and the person that is positive, when are they no longer infectious or contagious?
Yeah, that's a great question, and I think that's something that people are really wondering. And so the goal with getting a positive, so as soon as you have a positive, it's immediately reportable to us at the health department. Of course, we call the patient first, and then we start that investigation. The goal is to have that investigation done within 24 hours. We have a great staff here. We're able to do that very quickly. So we start the investigation there, and then what we want to know, number one, is how that person is doing, and then number two, who have they been around 48 hours before their symptoms started? Because remember, they're shedding virus and spreading virus 48 hours before they get symptoms. So it's important to know who are their close contacts, and close contacts are defined as anyone that's been within 6 feet of someone for more than 15 minutes, and that's cumulative. And then, so throughout the day, 15 minutes throughout the day. And or if they've had direct contact, so shaking hands, high-fiving, hugging, kissing, drinking after someone, We've seen it with touching footballs, things like that. That would be considered close contact. So we would want to err on the side of caution, and those that are close contact would need to be quarantined for 14 days from their last contact. People that are positive would be isolated, and they would be isolated for 10 days from symptom onset, but they would have to be fever-free with symptom improvement for at least 24 hours.
So what if they have no symptoms? Because we know that 40% of folks just won't have a symptom, or just a vague symptom, maybe a little bit of a, fatigue. I've seen some people, maybe have, bout of diarrhea, or, which is also a symptom, or the lack of sense of taste and smell. So they don't have symptoms. So when do they know that they're able to basically come out of their quarantine?
Yes, so through some studies, through this, we've found that we look at the date that they were tested. So when was the swab in their nose or in their throat? When did we obtain that sample? We go back 48 hours. That's when we start their contact tracing piece of it. But their date of onset, or their, I guess, day one, would be at the date that the swab was in their nose or mouth, when you obtain the specimen. And then it's 10 days from there.
So I guess what you're saying, and I think this is what the CDC is saying, we no longer test that patient for cure or lack of infectivity. So we no longer do that. Is that correct?
That's correct. And one of the reasons we don't do that is because we know that virus can be in the nose or the throat for months. We don't recommend repeat testing for up to 90 days after that initial positive. And the reason is because we haven't seen infective virus after really 10 days after the onset of illness.
So basically, I think, just walk this back. So when you're talking about within 6 feet of an individual, and you say cumulative, so meaning like if I was positive for COVID and neither one of us had a mask, and you were within that distance for 5 minutes, and then a little bit later in the day, another 5 minutes, and then another 5 minutes, that would be then considered a close contact.
That's absolutely correct. Yes.
So we're coming into the flu season, and I know we were talking a bit before the program about the 2019-2020 flu season, which we had like 62,000 deaths. Okay, and thus far of COVID we're over 200,000. And so, we're getting ready to come upon a break, but I really want you, Dr. Stewart, to talk a little bit about what we can try to do to prevent, influenza, okay, compounding the fact that we have COVID. And I want you to kind of talk about the importance of vaccination for influenza, and also about some of the 5 things that you've talked about before that I think not only would help us protect ourselves from COVID, but also would protect us from other viruses such as influenza. So we're going to take a commercial break, and when we come back, Dr. Stewart's going to talk about influenza, and in fact, she's actually going to vaccinate me for the flu virus for this year.
This is Doc Talk, brought to you by Plateau Medical Center. And now, Dr. Paul Conley.
Welcome back to Doc Talk. I'm Dr. Paul Conley, and tonight our special guest is Dr. Anita Stewart, as we are here at the Health Department here in Fayette County. So, when we went to our break, Dr. Stewart, we're talking a little bit about that we're in the flu season, or at least we're coming upon the flu season, and we're talking again about the fact that we had 62,000 deaths from influenza. We were talking a little bit the other day, you and I, on the phone about the fact that currently, we're seeing COVID, and we're seeing, our ICU capacity, pushing over 50%. In fact, one day you even said we had 80% ICU capacity because, we're still seeing the folks that are having, bypass surgery or heart attacks or strokes or intracerebral bleeding or what have you. So these people also need ICU support and ICU care as well. So I guess, the concern, in a state like ours where we don't have, such a capacity or surge capacity, I guess the concern in my mind is, if we had 62,000 deaths last year and we had 740,000 hospitalizations. I mean, that's 750,000 people that were hospitalized last year. I think it's very concerning to me, you know, that if we have something like that again this year, you know, it's going to overwhelm us. So I want you to talk a little bit about the things that we talked about at the break, about how we can protect ourselves from influenza, and maybe you can go over those 5 things again that's so important about how we protect ourselves from transmission from COVID and even other viruses.
Yeah, so I do want to mention that in Australia, you know, remember the Southern Hemisphere has already had influenza this year. And one of the things that they saw in the Southern Hemispheres is that flu numbers were much better. And one of the things that we're extrapolating from that is that it's likely from the preventive measures and the behavioral measures that we have put in place. So staying outside, social distancing, using masks, washing our hands, staying home when we're sick. Those are all ways that we can prevent the spread of viruses, not just COVID-19, but also influenza. And so one of the concerns that we have when it starts to get cold and it gets to be fall and winter, people congregate inside. So it's going to be really important, everyone, is we've got to be very mindful about social gatherings, to really trying to limit those. We're seeing a lot of community spread from gatherings. So the more we can do things virtually, I know it's not nearly as fun, but for right now, it's certainly the safest.
Yeah, I think, you know, we were talking about earlier about, you know, maybe people watching the show about, you know, I know people have good intentions, but, you know, are you seeing these outbreaks in churches, people going to church, or we talking about gatherings such as birthday parties? Maybe you can comment a little bit about, you know, what are your recommendations as far as birthday parties and church gatherings and gatherings inside in general?
Yeah, I think the better the ventilation and the more spacing you can have, that's going to be better. Really limiting the numbers, limiting mixing of groups. That's where we know spread happens. And no one wants to give great grandpa COVID, because what we know is that when elderly people or people that are vulnerable, immunocompromised, have lots of chronic diseases, they do not do well with COVID-19 or with influenza. So please, please, please try to be mindful of that and just keep your space and limit those activities right now.
And so as well, I mean, so see, there are 2 different viruses, so you know, you could have both viruses at the same time, and I think, you know, these, you know, folks that have comorbidities, obviously that would basically overwhelm their immune system.
Yeah, I think that it wouldn't take much, especially if they already had influenza, for them to be infected with COVID-19 or vice versa because of their immune.
So let me ask a little bit about, you know, flu vaccine. So we have a vaccine for influenza, and so who should receive a flu vaccine, and when should we start vaccinating? Like, when is a good time to get your flu vaccine, and who should get that?
Yeah, so the CDC recommends, you know, when the vaccine is available to start vaccinating. So now is the time. And, you know, the American Academy of Pediatrics, I love it. Their tagline this year is "Flu before boo." So the goal is to get all our kids and all of our population vaccinated before Halloween this year, just so we know that we have things on board, because we do start seeing cases in this time of year throughout the winter and the rest of the season.
So, and again, so what age should we start?
So anyone over the age of 6 months is eligible for a vaccine. So really anyone that's over 6 months at this point.
So it doesn't have to be someone with heart disease or lung disease or diabetes. It should basically be anyone over the 6 months, unless they have some other reason not to. And from what I've read, even as well, you know, even, you know, the asthma and allergy folks even say, even if you have an egg allergy, you can still receive the flu vaccine. Is that right? That's
absolutely right. And so we don't consider that a contraindication anymore. We do recommend that if you have an egg allergy, work with your local allergist or immunologist to help give that in a controlled manner, and there's a certain way that we do that, but we absolutely recommend the vaccine even for those with an egg allergy.
Well, I haven't had my flu vaccine yet, and we're in flu season, and I think, I'm not, obviously a pediatric patient, but I think, it should go for all of us, flu before boo. So
Yeah.
would you be willing to give me a flu vaccine here on the show?
Yeah, absolutely.
You would love that, wouldn't you?
I would love it.
You'd love to stick a
I would
needle
love.
in me.
I think that any way, in any fashion that we can get everyone vaccinated for flu this year, that will be best.
Well, I'm ready to get my vaccine, so I can be.
So the CDC has guidelines this year, and theirs is mask up, wash up, which I'm going to put gloves on, and then sleeve up. So we're going to do that today. So let me get gloves first. You got your sleeve up? You want it in the right arm or the left arm?
I scope with my right arm. So is this
So
going to
the
hurt
left
that
arm.
bad? I mean,
No, it's not
do
gonna
I really
hurt.
need to determine which arm?
Well, I have to know for
geez.
documentation.
Oh,
Yeah. Okay. So I have the influenza vaccine here. This is
so maybe you can describe a little bit about, for the folks watching the show, about the different types. I mean, we talk about high dose for older folks over 65. I mean, so what exactly is that? Because sometimes I'll have patients say, should I receive that high dose vaccine versus a standard dose vaccine? So what does that really mean?
So what that means is that what we know as we age, especially over age 65, is that our immune system sometimes isn't as robust in our response. And so what they've done is created a higher dose influenza vaccine to help our patients that might not have as a robust of a response to have a better chance to have a better immunity to influenza.
So 65 and older folks, we would want to consider the high dose.
Yes, correct.
All right, very good. So
All right, are you ready?
I think so. I'll try not to cry. Well, you did test me earlier, and
I did test you,
and I
yeah.
did okay with that.
Okay.
I think you've done this before.
I have
She's a professional.
I'm a pro.
I didn't even feel that. That's nothing.
Yeah. And then I'll give you a Band-Aid. You're not bleeding, but that's like
because
your
you
special
because you
Band-Aid.
did so good.
Because you did great.
Because
yeah.
you did
I wish
so
I had
good.
a sticker for you.
Oh, well, thank you. So I tell you what we're going to do is I'm going to put my coat back on because it's getting cold out here. We're going to take a small, quick break, and then we're going to finish up the show, and we're going to have some closing comments from Dr. Stewart. So you guys stay tuned, and we'll be right back with Doc Talk.
This is Doc Talk, brought to you by Plateau Medical Center. And now, Dr. Paul Conley.
Hello, it's Dr. Paul Conley, and thank you for tuning in to Doc Talk. I just had my flu vaccine, and I'm here with Dr. Anita Stewart, and she's going to talk to us a little bit about COVID vaccine. So, I keep seeing on the news how we're at this warp speed. I hear this term warp speed, and we're working on a COVID vaccine. But currently right now, we don't have a vaccine. And so maybe you can talk to us a little bit about, since we don't have a vaccine and our therapeutics are limited, how do we address that, as far as preventing and prevention of COVID? And maybe you can talk a little bit about when we do have a vaccine, does that mean that we've crossed the finish line at that point?
Yeah, those are all really good points. Paul, thank you for asking that. So I think it's really important to remember that what we have in our toolbox right now are the behavioral measures. So practicing social distancing, wearing masks, washing hands, limiting social gatherings, outdoors over indoors, staying home when we're sick. Those are the things that are going to really make a difference in preventing the spread. Our therapeutics really aren't there yet. We do have corticosteroids for really sick patients. Those have been shown to help. We have remdesivir. There's some promise with convalescent plasma and monoclonal antibodies, but there's no like magic bullet right now. So we are waiting for the vaccines. They are developing very quickly, but remember, one thing I want everyone to know is that the difference is these companies have money right now being poured and funneled in to help get these developed as quick as possible, and that they will be tested. There's about 5 right now that are in phase 3 trials, and that means they're very large, 60,000 plus people, and they're testing how well it works and how safe it is. And so we're going to gain a lot of knowledge from that and hopefully find a vaccine that can help reduce the spread of COVID-19.
So as far as again with the vaccine, what's our anticipated timeline? Do you have any idea about for the general public? Because I keep hearing people say, hey, once we get this vaccine, we won't need to wear masks anymore, and it'll be gone. So what's your stance on that?
Yeah, I think it's going to still be a while before it's available for the general public. I think that we will have a vaccine by either the end of this year to the beginning of 2021, but likely won't be available for the general public till probably late spring, early summer. And it's still, we're going to still have to wear masks and practice all these behavioral measures because we know, just like with the influenza vaccine, there's nothing that's 100%. It takes time for those things. It's going to take time for the virus to see what happens once we do have the vaccine.
Well, I tell you what, I really appreciate you so much. I mean, you have been so wonderful to come on the program. You've been on here multiple times. I know that you have taken a lot of time out of your life to that. So when you talk about in this together, you definitely are leading from the front and you're blazing a trail. And Dr. Stewart, I really appreciate you again for coming on the show.
Yeah, well, thank you for having me.
You're always welcome to come on the show. For those of you watching, I'm Dr. Paul Conley. You've been watching Doc Talk. Until next time, good night.
Doc Talk with Dr. Paul Conley is copyright Signer Foundation and is responsible for the content.